Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas. Sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you to grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. I'm in Burrawang in New South Wales in Australia, and it gives me great pleasure to welcome to the studio Dr. Geoffrey Hall, who's in East Bentley, a suburb of Melbourne, Victoria, so same time zone, same country. Jeff, welcome to the Ultimate Dental Podcast. Thanks for joining me.
Thank you, David. Thank you for your invitation. It's very kind of you.
Now, Jeff, you and I go back a long way. We met, I think we actually met. We were discussing before. I think we actually met first time at Hayman Island.
We would have actually.
So that was about the same time. And since then, I retired myself medically because of arthritis, and you've continued on. But you've had a very interesting career in dentistry because you've been a dentist, you're an orthodontist, and now you're a prolific educator in the dental space. So over to you, Jeff. Tell us your journey. Did you always want to be a dentist or an orthodontist when you were a child?
No. I'll try and cut the story short. I have to be honest with you. I never wanted to be a dentist. Probably like a lot of dentists, in all honesty. I think I was the only person who failed carpentry. I went into a profession that worked with my hands, which was just absolutely crazy. But my brother is a well-known rheumatologist here in Melbourne, and he's 7 or 8 years older than me. And I wanted always to do medicine, which is, I think, what a lot of us wanted to do. And I didn't get into medicine, as I'm sure that a lot of dentists would understand that. So my brother said, do dentistry. So I did dentistry. And I've got to say, I really didn't enjoy it. And I owned a private practice for a few years, and I hated general dentistry, really hated it. In fact, to the point I used to wake up in the middle of the night, dry reaching, and I used to have, and this is a true story, I used to have my worst nightmare that my 10 worst patients would turn up in the one day. And this particular morning, 5 of them turned up. And I actually cancelled the afternoon, and I went to the local university, which was Monash University, where I was practicing. I applied to do law, and all I wanted to do was sue every dentist for putting me into this. Fortunately, I didn't get into law because I wasn't the mature age student at that stage. I was about 20, probably 23, 24. So I thought, how do I salvage my dental degree? And I did the skip training, which you would have done as well. And it was probably the only area of dentistry that I really didn't know anything about. And I thought, this is more knowledge rather than technical skill. And so at the time, my brother was, in fact, studying at the Mayo Clinic. So he was actually doing his rheumatology at the Mayo Clinic. And he said, Jeff, if you're going to do this, you should go over to America. And so I applied to 35 universities, and I eventually got accepted to 2 of these universities. That's another story in itself. And I went over and trained at the University of Pennsylvania at Penn, and it changed my entire life. And they gave me what the expression in America, the fire in my belly. And so I loved it. And from that day on, I loved orthodontics because it was working with my mind. Yeah, there was a little bit of hand-eye coordination, but the funny part is in orthodontics, back then it was only braces. There was no such thing as aligners. And if the brace was in the wrong position, which it always was, okay, we would just take it off and reposition it. It was never a big deal. It wasn't a big deal. All of these myths out there, where you've got to be this great wide bender and all that type of stuff, doesn't exist, And so it's so much easier. So when I came back, I was a clinical orthodontist, but I was always had an entrepreneurial tendency. as well.
That's interesting, Jeff, because I had a similar experience. I also wanted to be a medical practitioner.
I think we all do.
I didn't get the marks, and so I went through first year, and I was first year at Sydney was interesting because it was only 2 terms, and then fourth year was going to be 4 terms to catch up that extra term. So we were doing annuals in August, and I remember in December of first year doing my exams, and I said to my parents, I said, I don't think I'm ready for these exams. I said, I'm just going to quit and go back.
Exactly the same. Yep.
And my mother said these words to me. She actually said these words when I thought at the start, what am I even going to dentistry? I'll go back to school and do the HSC again. And she said, why did you put dentistry down if you didn't want it as a choice? So I did it. Long story short, end of second year, there was only 2 people in my year who didn't get a pass. I was one of them. 3 distinctions and 2 credits. And guess what I got for that? No recognition. No recognition. I finished about 8th. There was people who had high distinctions. Out of 5 subjects, 3 distinctions, 2 credits, nothing. Third year, I wound myself back a little. 1 distinction, 2 credits, 5 passes. I got a distinction. I got the only distinction in preventive dentistry. Guess what I got for that? No prize either.
Yeah.
So I wound myself back again. 4th year, 12 subjects, 12 passes. 5th year, 8 subjects, 8 passes. I was working, during 4th and 5th year, I was working a part-time job, 5 nights a week, 30 hours a week, in an RSL club, pulling beers, serving drinks on trays. People said I went to dental school for something to do during the daytime, but I always wanted to be a doctor.
Yeah.
But
Yeah.
after second year, and I actually got that transfer after second year with those 3 distinctions, 2 credits, I just said, I'm 3 years away from earning an income. Everybody I went to school with was out being a plumber or whatever, and they had jobs, and I thought, I just want a job. I want a life. I don't want a
I
career.
was exactly the same. Every year I was going to defer, and then I thought, I've only got another 2 more years, so I'll just do it. But what's interesting with all that, I think there's a take-home message for younger people is whatever your passion is, life's too short. I mean, I wish this education part is what I love doing now. I really love it. And I've cut down my clinical practice. I do 1 day every 2 weeks now, and it's just a great balance. And I'm the happiest that I've ever been. And my advice is to a young person, whatever you want to do, don't stop doing it. One of my closest friends, he's my closest friend, is a guy called Michael Kemp. You probably haven't heard of Michael, but you've probably heard of Scott Pape, the Barefoot Investor.
Mm-hmm.
Well, Michael is the financial analyst behind Scott. Michael was a periodontist. Okay. And Michael, I shouldn't say this in public, but he too hated being a dentist. And so he did his MBA. My father talked him into doing an MBA. And then after that, he worked for Potter Warburg, worked for the Week Board for BT Australia. When I came back from America as an orthodontist, Michael said, how much can you earn as an orthodontist? Back then I thought about $200,000 a year. And he said, that's obscene, because they were working him to the bone. So he ended up applying to do orthodontics. And fortunately for him, he didn't get in. And he got into perio. And it was because of his MBA. The degree that got him out of dentistry was the degree that got him back in, because he had a higher degree than a bachelor degree. It was just stupidity. And he got in just at the time when implants were starting. And he started working with Steve Chen, who at the time was probably the best periodontist in the country. He became Steve's partner. So I think he was netting back in 1995 close to $1 million a year. He was netting, and he was investing it at over a 20% return.
Mm.
Okay, and he's written 3 books, and I'm going to say to you, if you ever read his book, the best one was the Ulysses Contract. Yeah, and to this day, that's all he does. He is brilliant. He's very much on the spectrum, but he is absolutely brilliant.
I'm just writing that.
Have a read of it, the Ulysses Contract.
I'm just writing that.
In fact, I'll send you a copy of it.
Well, please do. As you know, I'm going to be housebound for 6 weeks after I have this.
I will send you a copy. Yeah, it is probably it's the best book for young people on investing, because he makes it so simple what you do.
But it's interesting that you were able to find your passion. I had a passion as a school kid to be a radio announcer, and I did fulfill that in later life in community radio. I quite enjoyed it, but like anything with any career, half the time you end up in a place where the people above you are in charge of you aren't really good managers, or they have complexes. And so my time in community radio, I think, I've got some really good friends who encouraged me and saw what I could do. And I've got some people who were jealous of me as well. And I'm one of these people, Jeff, if it's not fun, then I'm out of there, because there's
Well,
other things that you can do that are fun. And so
yeah,
sadly,
you and I are the same. And I keep saying that if our teaching, if I wasn't enjoying it, I'm not going to do it anymore. And and that's why cutting back the practice to a day every 2 weeks, it's fun. I actually go in there and it's fun. It's not the drain that it used to be. I've got a great business partner in the practice, so that makes a big difference as well.
yeah, no, that's important. It's funny, my wife, as you know, has her own business coaching dentists or dental practices on how to answer the phone better. And we were at ADX in 2020, and the stand next door to us was a guy who did handpiece repairs. And he used to come to my practice, and he said to me, I can't believe how different you are 6 years after you've left your practice than you. He said, you're just always so highly wound up at your practice, but you're a different person. Sometimes we don't realize what we're doing to our bodies because to me, and you're probably the same, when you put your heart into something, you intensify. And sometimes it can actually be to your own detriment as well.
Yeah, and you and I are probably similar era. The HR problems now with the young people, I don't think we can deal with this anymore. It's really difficult. So here, where I am at Ortho Ed, I've probably got two or three main staff, and it's beautiful. I go to the practice and we've got 15 girls there. Yeah, I'm only there one day every 2 weeks, so I can get over it. But every day it would be a trauma for me now. I just can't deal with it. And it was worse when we were with Dental Corp and you had to deal with their HR as well.
Yeah. It's that's a whole other subject.
It's a whole other story. Yeah.
Yeah, we're not going there. We'll be down a rabbit burrow that we can't back out of if we go down there.
Right.
So you came back, you're an orthodontist. What then created the desire to then become an educator in orthodontics?
Well, I always love lecturing. Okay, I get it from my father, who passed away when he was 99. But my father, he loved to be the centre of attention. So I think that's half the problem. I love being up on the stage. I love being the centre of attention. I always have, and so I've always been lecturing overseas, KOL for different orthodontic companies, etc., etc. Then, I got involved. I set up the Seattle Study Club. You've probably heard of that. So I started that in Australia. So I gave that to the Sydney people and to Adelaide. And I set up a study club called the New Horizons Study Club, which was based in Victoria with a friend of mine, Andrew Dillon, who's a prosthodontist here in Melbourne. And so I've always loved continuing education. I really have. So after speaking to lots of dentists, they all want to learn something and nobody was there to teach them. And the ones who were there to teach them were really teaching them incorrect principles or just teaching them a technique and not sound principles. And I come from a background of everything's got to be principle based, okay? And then you work from those principles because there's so much, excuse the French, so much crap out there from supply companies, from manufacturers, from, that they all, aligner companies especially, they all just want to tell you a story. To me, it's a story time. Yeah, it's story time for kids. And I can't believe how gullible dentists are. Yeah. So somebody gets up on stage and they tell you this is what you do. They show one case and the whole practice turns around based on one case. And that's like basing your COVID vaccine on one person. I just don't believe that dentists who are bright people just believe all this stuff that they get told. Yeah, I just find it bizarre. I find it totally bizarre. So I sort of made it my job to educate. I enjoyed. I've obviously made it into a career now, and I love it. But to me, I want to break down the myths that are out there. And if I'm going to teach people, I want to teach it the right way and teach it in an ethical way. And I'm sure you were the same at uni. They taught you no orthodontics. The orthodontists, you've got to admire them. They're the one profession, the one part of our profession anyway, that have kept it as such a closed shop, And I explained to my dentist, there's so much orthodontics which is equivalent to doing a upper central incisor endo. And when you say to the dentist, would you refer out an upper central incisor endo? And they just laugh at you. Well, that's like orthodontics. You're referring out the most simple of simple cases. And the problem that we have, and my orthodontic colleagues are pissed off with me, I always believe it's because of my good looks and my personality, but they're pissed off with me more because of they've made their money because of swings and roundabouts. They make their money on the easy cases. Well, it's time for everyone to step up and for them to actually charge more, but to do the more difficult cases. And I would argue a lot of them can't do the more difficult cases, and that's where the problem lies.
I've heard that. I've heard that sometimes the most vocal against general dentists doing orthodontics have had cases themselves that have been presented to dental councils that have gone
Absolutely.
pear-shaped.
Yeah, well, I've been an expert witness for a couple of these well-known ones who run the Australian Orthodontic Board. I just laugh because but that's politics, isn't it?
Often is the case, Geoffrey.
Yep.
Sadly, it's the little old man behind the curtain, as they ignore that little old man behind the curtain, as they say in The Wizard of Oz.
Exactly right. Exactly right. Yeah, they're marketing themselves in a different way to stay busy.
Yeah, it's sad, but yeah, my orthodontic undergraduate education was, you have crooked teeth. Let me write you a referral.
Exactly right. Exactly. In fact, one guy in our course the other day actually said that was their exam question, how to write the referral to an orthodontist. I said, are you serious? He goes, absolutely.
But like you, I started with skip through it because when I was searching for a practice to buy, one of the ones that I looked at was a highly geared general practice doing ortho.
Yep.
And my friend who came along with me just to keep me company, he said, you need to do some orthodontic education, and then skip through it appeared. But I still remember the first bracket that I ever had to put on. I was terrified.
Yeah. Well, it's funny you say that because I talk to these people, because we've trained close to 2,000 dentists now. And you say to them, how many of you take out impacted wisdom teeth? And they all put up their hand. And do you worry about guttering half the mandible? No, they don't care. But are you scared about putting a bracket on? Absolutely. I just find it bizarre.
Yeah, it's I guess it's your perception of danger. And it's funny, we talk to doctors the same thing. You ask a GP doctor, would you give an injection in the mouth? Oh, I'm not going anywhere either. There's nerves and all sorts of stuff in there. And then you talk to a dentist about putting an injection into somebody's shoulder. Oh, I'm not doing that. That's outside my skin. Well, the shoulder's just one muscle.
Exactly right. Exactly right. Yeah. So orthodontists have, I think, a lot to answer for because I don't think they have educated their colleagues well at all. Endodontists have, periodontists have, So, but the orthodontic profession, look, I've got to hand it to them for a political aspect. They've done a great job at maintaining their profession, but there's enough work for everybody. There's enough work for everybody. And the problem with a traditional orthodontic practice is traditional orthodontic practices have high volume of patients, 80, 100. At one stage I was seeing 120 patients a day. And my business partner, Muffin, still does. Okay, I don't do that anymore. I'm getting too old for that. But that's how we made money. Yeah, it was high volume. Now it should be, and I keep saying, why don't you halve the number of patients, increase your fee by 15, 20%, reduce your overheads, but treat the more difficult cases. Everybody's a win-win. But I don't think that's going to happen in my clinical lifetime anyway.
It's interesting you talk about you changing from general dentistry to orthodontics, and that friend of yours who ended up being a periodontist, because when I was at uni, one of our hardest demonstrators in pros was a prosthodontist, and then he went back and became an orthodontist and worked in southwest Sydney in an orthodontic practice. And I thought, that's a really different sort of career change.
Yeah, well, I know a couple in America who have done that as well. I don't understand it. No, I don't understand it at all. But orthodontics, the thing I like about it is we can delegate 90. In our practice, we delegate 95%. Aligners, you just about delegate 100%. It's just the only thing I do with aligners is I will do the digital setup. I'll do all the thinking part. Everything else is delegated to my OHT or hygienist. It's just fantastic. From a GP point of view, it's magical. It's absolutely magical, the leverage you can get. You can be in one room doing your crown and bridge, $1,000 an hour, and your hygienist is actually billing out at $800 an hour. Now, the only thing I'd tell these dentists is don't put them on a commission.
Fair enough. Yeah, fair enough. Tell me, for some of our audience here, they would never have experienced dentistry or orthodontics without aligners. But when did aligners come into vogue? when did people actually start taking them seriously, and
Yeah,
what's the state of play at the moment?
that's a great question. Well, I was involved with the beta group of Invisalign, and that was 1999. So I actually was the one who brought Invisalign to Australia. And so I was there right on the ground floor. So it's been around now for 26 years. I remember when it was first released at the American Association of Orthodontics, and and the everybody said this won't last, this won't last. Well, here we are now. It's the fastest growing market. Truthfully, it was funny when Invisalign first started. I don't know whether you know the story. It spent $40 million on advertising in America in 2020. Sorry, not in 2000. And out of $40 million of advertising, only one patient went ahead with Invisalign. And what happened was that everybody went to their orthodontist, because only orthodontists could do it at that point, and they talked them out of Invisalign and talked them into clear braces. And so the clear braces market just skyrocketed. So everybody, and that's what happened. What Invisalign did was increase the demand for adult orthodontics. Now, Invisalign per se, and all aligners was terrible until that 10 years ago. The attachments were bad. The technology wasn't great. People, pulled their hair out because they didn't get the results. But I would say since about 2015, now it's become really good. And it's getting better and better. The technology, the education, but you cannot believe the AI that they do. You can't trust it 100%. It's getting good, but you still have to override it. So I use the analogy, this is like a Formula One car, because everybody, you, myself, whether you're using Invisalign, Spark, Angel, or one of the other companies, we have the same software. Everybody's using the same software. And so it's like the Formula One car. If I was driving if I was against Max Verstappen, who would win? Max would, because he knows how to drive that same Formula One car. And that's what we have to teach people with aligners. We have to just teach them how to drive that car. But it gets probably even better than that, because there are treatment planning services around, and we have one of them called CAPS, but there are other ones around too. And the one great thing about aligners and a treatment planning service is whoever does that treatment planning service and they give it to you, you will get exactly the same result as I would get. The only caveat on that is a little bit of clinical stuff that you've got to do the right IPR, got to make sure that they wear it well enough. But apart from that, now I know nothing else in dentistry, nothing else where if one person does it, it can be replicated to the next person. Aligners is that. So that makes us a great scalable business for anybody.
That's a great advantage. Jeff, just let's talk about IPR, because
Yep.
that used to terrify me as an Invisalign practitioner or an aligner practitioner. Is there an alternative to doing arch expansion, or
No.
is IPR the best choice?
Well, it depends. It's a case-by-case basis, but here's the bad news. And the bad news is there's far more IPR required than what the aligner company tells you.
Mhm.
Okay, and the reason I say that, and we discuss this in our courses, because the IPR, let's say they tell you 0.3 millimeters, for the lower three anterior teeth, just for argument's sake. The IPR is based on the anticipated final result. So it's based on the expansion that they've done, whatever it be, but it's based on 100%. Now, the problem is every study shows you only get 70% of that, which means if you don't get as much expansion, you need more IPR. So the IPR that the aligner company tells you is the best, the minimum that you need to do. So they're the clinical things that we need to teach to give you the most predictable results. This is stuff that the aligner company doesn't tell you. The other thing the aligner company doesn't tell you is there is what we call a default before you even get any IPR noted, and that's 0.5 millimeters. Okay, so if you have less than 0.5 in the whole arch, they'll tell you there's no IPR needed. So these are all the problems. So you have to override that clinically, but that's just one part of 3 or 4 different problems that needs the AI overridden by yourself.
Yeah, it's fascinating. I know that your process CAPS helps dentists to manage the case based on what the initial treatment plan comes from the aligner company.
Exactly
No,
right.
and I think that's a real advantage. I was tearing my hair out when, you get a case and it's 14 aligners, and then you have to send it for a refinement, and it's 16 aligners in refinement. And you think, well, we're 85% of the way there. Why do we need 16 more? And why do I have to put more attachments on?
Well, you're lucky it's only 16. He's with some cases where they're 14 at the beginning and 35 afterwards. And people
No,
go,
no,
"What?"
no.
Yeah. So, but that's the problem. That's the problem. And then this is typical of aligner companies. But there's so many myths out there. In fact, I'm in the process of writing a book. I should be finished it in about March. And it's called The Hidden Strategies to Add Orthodontics to Any Dental Practice. But I'm going through all of these myths out there because I think it's important that you don't just do a 2-day course and think you know everything. And I think you've got to be trained with these sound principles. So I've just now done the first draft of it, so I'm getting excited because I can see it come to fruition.
That's great because, as you said, the aligner technology has really only come to fruition in the last 10 years. Well,
Yes.
it's been 8 years since I hung up my drills, so I didn't really get to experience this modern era of aligners, and it did become a frustration to me
Yeah.
in the end of trying to help people who didn't want braces, and ultimately there was cases that needed to go to braces even at the end to get the result, which is kind of
Yeah.
defeating the purpose.
Totally correct. But here's a real positive for general practitioners, okay? And this will really resonate with you because, as I tell them, it's all communication. Everything in dentistry is communication, which is where most dentists are pretty poor at, especially once they come out of university. But if you tell the patient, you know what, I can't get 100% for you because of the shape of your teeth or the color of your teeth. What I can do, I get 90%. I can finish off the rest with a little bit of very conservative cosmetic dentistry, maybe a composite veneer, whatever it be. So now for the general dentist, they don't have to get the perfection. That was the hard part. So if they preface the conversation first and they use this as a pre-restorative option, their life is so easy. We can show case after case after case how easy it is just to restore them. And then if they don't need it, if they're happy with it, you look like a genius, and you get all these great word of mouth referrals. You make these raving fans. I think aligners, I hate to use the term sold, but if sold properly or communicated properly, is the best thing for a general dentist as a pre-restorative option. And in fact, they should be having it done for every pre-restorative case. And it's a loss leader. The funny part about aligners is that as a general dentist, let's say you're charging $7,500, just for argument's sake. We charge $8,000. We get one fee. That's my fee lifetime for the patient. For the general dentist, you get the children, you get their uncles and aunts, etc., but you've got this patient now for a lifetime worth of perio, endo, whatever it be. The lifetime value, you can just about be doing aligners for free because of the amount of value that's bringing people in.
Yeah, I think a lot of dentists just think short term in terms of
Exactly.
patient, not consider that patient could be your patient for 10, 15, 20 years or more, just regularly turning up.
And they become high-value cosmetic patients. After they've had it done, they'll want the bleaching. They'll want the little veneers here and there. They'll be more interested in their long-term perio.
Yeah, because it is an investment, but you do see people turn up, and I bet you've had people who say, I had braces as a child, but forgot to wear my retainers.
Oh, that's that's another. To be honest, I think that is such a market out there for this relapse orthodontic market. I mean, I think it's just massive. And that's the one area that orthodontists would be very happy for general dentists to take over, because none of them want to see their own relapse cases. No, because patients don't want to pay for it, but there's really simple aligner cases. And they don't want to go back into braces. And that's exactly how Invisalign first started, because the guy who started, Zia Christie, he lost his retainer on a plane, and his teeth moved. He went back to the orthodontist, and the orthodontist said, I'm going to put you back into braces. He goes, are you nuts? And this guy was an MBA from Stanford, and he went through all the literature. And And that's another story because there was prior art already. So to this day, I still haven't figured out how they got a patent, but they did. And they got it for 20 years.
Who designs the attachments, Jeff? Where do they come up with these? Is it like they sit in a room and say, all right, we need to invent some new designs? Why can't they all just be the same as like the 4 different designs for Louis Vuitton? You know, they're all different shapes and sizes every time, different angles.
It's really funny you say that because once again, this is story time. So when Invisalign started, at one stage, they got a guy, I'm just trying to remember his name, they used to work in Connecticut with Charlie Burstone, who was the guru of biomechanics. So they brought this guy in and they decided they're going to have a biomechanical model. So they made those little optimized attachments which you're talking about. Okay. And I think it's a load of crap. Okay. And so I take them all off. Okay. And we only have two sort of designs and we just vary the 4 system. Okay. So it's actually a lot easier. But that is Invisalign's value proposition. You use us and we just do it automatically. But they're actually wrong for numerous reasons. Okay. They're wrong. So, and this is the other part that the dentists don't like, and that's the one criticism we get of caps though, because we put big attachments on. Because the bigger the attachment, the greater the pushing force, which is what you need from a biomechanical point of view. And here they are with these small little attachments, they don't have the pushing force. And then what makes it even worse is when you put your attachments on, if your hygienist or yourself has taken away a little bit of that active surface, which we can do, there's no pushing force. And people don't realise how important it is to accurately place the attachment. Because we're talking 1/4 millimetre of activity in each aligner. So if you don't have that, you just don't have anything. So everything every aligner company has a story behind it. For example, you've got one aligner company which says, well, we're going to do the cut on the gingival margin or even higher up because we're getting closer to the centre of resistance and therefore we don't need as many attachments. Well, can you imagine if you put any type of plastic on the gingiva, what's going to happen? It's going to get a sore spot, and what are you going to do? You're going to trim it away. So it's such a load of garbage, as if you're going to put pressure, 5 millimetres up on the gingival, okay? But this is the story that they tell you. And I've been in rooms where orthodontists go, that sounds great, but they don't think about it. I'm really disappointed with the thinking approach of dentists. In fact, it's funny. I tell this story. I ask everyone in the audience, and like I said, we've trained about 2,000 people. I said, how many of you read a journal, since you've graduated? And out of 2,000, we might have had 50. And I said, how many of you have actually read more than just the abstract? We had one. It turns out he was a PhD student. Okay. And so, because I keep saying, you know what, you can get an article that can prove anything you want. We have colleagues talking about airways and all this type of stuff, and So I've told them that what I'm going to do now, I believe that if you don't have orthodontics, you're going to die. And they look at me and go, I'm writing an article right as we speak, and I'm going to do a prospective study from the age of 10 to 110. And the ones who haven't had orthodontics, I guarantee will have died before they get to 110. Yeah, you can prove whatever you like with statistics.
Of course you can. Of course you can. 100% of the ones who have had orthodontics are going to die before they get to 110 too, Geoffrey.
Oh, well, I haven't put that. That's not in my conclusion, okay?
It's accidentally left out of your...
Unless I say it was poor orthodontics.
Yeah, so I can tell you why divorce happens too. 100% of divorces begin with a marriage.
I might have to use that line. I think that's perfect. I love it.
So yeah, it's fascinating. I was talking to a client yesterday, and she said she had a staff member who wanted a title like senior dental assistant.
Oh, yeah.
And I said, what's it? Out of 3 people, one of them is the senior, but they've all got the same job description. So really, they should all be doing the same thing.
Oh, yeah.
The aim is to drag everybody up and not to create a hierarchy amongst 3 people.
Oh, I know. To be honest, we used to have a practice. We used to have a practice manager, and I refuse to have ever a practice manager anymore. I have a clinical manager and I have an admin manager, but I will never have a practice manager. It never works. Never works.
I like that idea, clinical manager. I think that's probably a better term than senior. I think it's just...
Well, yeah, exactly right. Yep.
No, makes good sense. Jeff, the CAP service, tell us about that. So that's for dentists doing Invisalign, or sorry, aligners,
Alignment, yeah.
dentists doing aligners, dentists are interested in doing aligners and doing them properly, dentists who know that they should be doing aligners because, as you and I have discussed many time before, more than, what is it? It's 66%, 70% of patients in a practice have some form of orthodontic need that goes undiagnosed, unpresented, untreated, and it's there in every patient who.
Absolutely. And we're just talking about crowding and spacing. We're not even talking about deep bites, open bites, class 2, class 3. We're just talking about the most minor of issues, crowding as well spacing. And yeah, you're right, over 66% are in that category. So if you see, we'll say 10 patients a day, close to 7 are eligible for orthodontics. When people tell me they can't find a practice, and I think or can't find a patient, and I think you're going to be speaking to one of my friends, Max, soon from Co-Treat,
Yes.
and I think he's probably nailed that part of the problem. So I'll leave that to him. But we've worked with him on the aligner part. So, but I think he's really got a great solution. Great solution for owners of the practice, because I think one of the problems is, how can you control your associates as well? How does the owner know that the associates aren't missing out on valuable work? And I'm not talking about over-treating. I'm just talking about ethical dentistry.
Yeah, well, the benefits of orthodontics are, obviously there is a cosmetic benefit, but the periodontal benefit is dramatic.
The periodontal benefits
fake teeth are so much easier to clean and keep clean.
absolutely, and even from the occlusal factor, we know that if we can get the occlusion a lot better, we can actually improve the periodontal situation, and we can get the forces, more vertical. We can erupt teeth, so we can fix up angular bony defects that you guys have problems with in maintaining from a periodontal point of view. There's so many things. Yeah. A lot of our elderly patients suffer from what I call posterior bite collapse. They might have lost teeth, and then they get flared anterior teeth with diastemas opening up. I'm sure every dentist has seen that happening, and they've got to understand the diagnosis and treatment for those type of patients. So CAP started off as a treatment planning service. We were doing our aligner training course because once again, people need to understand a bit more about aligners, because if you start to believe the hype that the aligner company tells you, you're going to do 3 or 4 cases, you're going to be an upset dentist because your patients are upset, it hasn't gone the way you wanted. Okay. And that's what happened prior to 10 years ago, as in 10 years plus. So we'd like them to have education, but we've set up the CAPS treatment planning service to say, look, anybody who's interested in doing aligners, and if you qualify as what we call a loyalty member, we'll do your initial plan for free if you qualify. Okay. This is in Australia and New Zealand. So we will do your initial plan for free. Okay. And this has taken off exceptionally well. Okay. People go, well, what's the catch? Well, there is no catch. The aligner companies have come to us, and we work with 3 aligner companies at the moment, which is Invisalign, Spark, and Angel, and there'll probably be 2 or 3 others coming on board early next year. So that's going to be the big 3, 4, 5, 6 aligner companies in Australasia. And what they have said is, and this is why we started CAPS, the reason general dentists don't do a lot of cases, they don't have the clinical confidence or competence. So we're taking that away and giving them the confidence, because orthodontists are doing it. And we have a 3-tiered system of orthodontists doing it. Okay. So you have one, and then we've got a quality control group, and then we've got a quality controller for the quality control group. So we make sure that we get it right. Okay. And so there's really 4 when you think about it, because you've got the aligner company doing the first setup anyway. What's interesting, the statistics are 70% of people press the approve button for the first setup to come back. And that's including specialist orthodontists. That's scary. That is scary. And everybody on the lecture circuit will tell you that they, in their own cases, me included, we will go back 3, maybe 4 or 5 times on every case. I've never, ever approved a case day one. Never.
Oh.
Okay. So, but this is what happens. So CAPS got set up for that. But now we've extended the services where it's an where we can give more education as well, and we can do mentoring as well for people. And what we can also do is a little video for people. So in other words, if they send the case, because a lot of dentists, they want to know more. Okay. And so what we can do is a 10-minute, 5-10-minute video. This is what the changes we've done and why we've done it. So they can have every case that they do as a learning exercise for them.
Well, that's phenomenal because, having been through that aligner career back in the 2000s, I often felt like I was on my own and just
Yeah,
relying on what the company was telling me. And there was nobody. I had a good friend who was an orthodontist, and yet it was. I just felt like I was an inconvenience to ask him because I felt like he felt like I should have been sending him the cases instead of me doing them. So.
yeah, but yeah, in all honesty, back then he probably didn't know anything either.
Mhm.
Okay, because what we knew was so bad, and when we look back on it, yeah, and it's probably no different to general dentistry. You look back 30, when we first graduated, go, did we do that? Did we do that? That's what we were taught.
You mean pin amalgams?
That was the last filling I did. Was a 3-surface 4-pinned amalgam.
Oh my goodness, yes.
That just shows you how long ago, 1987 filling.
Mm, mm, mm.
And you know what? I haven't missed it for 1 minute.
Yeah, yeah, I understand that. When I was telling you how I was, going to speakers meetings in America, and somebody asked me at one of them and said, "How do you feel now that you're not seeing patients anymore?" And then they said, "You don't have to say. The look on your face says it all." Yeah, I miss the patients and their stories,
Yeah,
but
exactly.
but but the intensity of what you have to do because every time you stop to have a chat, you're actually costing yourself money because you have overhead still ticking away,
Absolutely.
and you're meant to be providing a service that then provides a profit for the business and provides
Yeah.
people with jobs and spends the money in the community, all that sort of stuff.
Well, I think we've done ourselves one of the biggest disservices. Yeah, if we speak to our lawyer, they ask you, how have you been? And that's already racked up a bill of $100 just to tell your lawyer you've been okay. Yeah, and I think we base our fees on health funds. We base our fees on what other people charge down the road. We should be just be saying this is our hourly rate plus our material cost or whatever it be. I
Well,
mean, that's should be doing it.
Jeff, I don't know if you've had to deal with landscapers, but they actually charge their clients for equipment that they bring. So if they need to drill holes with an auger, they charge you for an auger that they've already bought and paid off, but they continue charging you. They charge you for a tractor. Now, imagine if I turned up and said, "Look, I'm going to do this implant, but I use this special drill, so I'm going to
Yeah.
charge you for renting that drill to put that in." Or I'm gonna
What a great return on your investment of the drill.
yeah. Well, that's exactly how I was finding it with the landscaper,
Yeah.
and yeah, they can be very creative in how they itemize things. And
Well,
if you ask ChatGPT if that's okay, they say yes, and then you say, "Well, can I do that in dentistry?" They go, "That's frowned upon." You go,
well, David, as we're winding up soon, I'll tell you the story. This is a story of a guy who comes to a house and he needs to put a nail on the wall to put up the painting. And he's put the nail on the wall and he's charged this guy who's a dentist, charged him $100. How do you justify charging $100? He goes, it's $1 for putting the nail in the wall and $99 to know where to put it. And the dentist goes, shit. He goes, I'm a dentist. I can't charge that hourly rate. And the guy goes, when I was a dentist, I couldn't charge it either.
"Yeah, that's the truth." But more importantly, Jeff, it's not about the knowing where to put it. It's actually the enjoyment that the person has of looking at the picture or the
After
photograph or the painting that they love so much, and that inspiration they get from having that hung in the right position.
Now, it's funny you say that because you asked about my career, and I was trying to get into America, and there was a guy in Melbourne called Steve Seawood who was an unbelievably eccentric orthodontist. He would band every tooth back then. He would solder his own face bow. He did his own retainers. And I was trying to get a reference from Steve Seawood, and we were walking down Spring Street in Melbourne. We had dinner. And Steve said, why do you want to do orthodontics? And I said, I want to make people happy. He goes, what a load of hog shit. Okay, what? I said, I was really taken aback. I was a young guy at that time. And I said, Steve, why did you why do you like orthodontics? He goes, I love seeing my before and after models. And after 10 years, I actually understood what Steve meant, because anybody can straighten 6 front teeth, okay? Put a few braces on. But what you want is exactly what you've said. It's that buzz that you can do something that other people can't do. And you've got this perfect occlusion, whatever it be. It's your satisfaction, not necessarily the patient's. The patient satisfaction is easy most of the time. I mean, you're always going to get your difficult patients that you never, ever can satisfy. But 98%, you're going to be able to satisfy them, but you've got to satisfy yourself. And that's what the buzz is for me.
Yeah, I'm glad we've ended on that happy note, Jeff, because we did start off with that bad dream of seeing your 10 worst patients appearing
No,
as
only 5 of them turned off.
only
Only
5.
5.
That's still enough to give every dentist nightmares.
Yeah, I know. I'm sorry to do that.
I had a friend when we graduated, we used to get together, a group of us, and one guy, he used to, like 2:00 on a Sunday afternoon, he'd just go into meltdown, worried about what was going to happen on Monday morning.
Oh,
And
yeah.
it was something that I never experienced, thank goodness. But
Well, I had a boss once that said, "You should take home your treatment cards the night before, so you know what you're doing the next day." Well, I only did that for 2 nights because it was the worst 2 nights of my entire life.
yeah, I guess you've got to have a plan. I think if you know that's an unprepared person, because that's usually somebody who, I say dental appointment books are like those before and after pictures of wardrobe advertisements. There's the wardrobe with everything just jammed in it, and then there's the one where all the shoes are up here and the shirts are over here and the ties,
Yeah,
and that's what an appointment book should look like. But most
exactly.
people, it's just jammed, stack, 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 stack. You can't get out of first gear when
No,
you're just jumping around, and
no.
people put it in on time only.
That's I reckon if to run a proper practice, and orthodontics is very much like that, you have to know how to schedule appointments properly.
Mm, mm,
That, I think, is the key to a successful practice. That and communication skills, and then you've nailed it.
yeah. Well, you have to, but getting people to stick to that too,
And getting your staff to stick to it.
that's it. It's
Yeah.
we we used to have patients say, "Can't I have that spot there?" And my wife used to say, "Yeah, you can, but that's when David's doing a root canal. Now you don't need a root canal, but if I put you in there, you're going to get a root canal."
I
Yeah,
love
all right, I understand.
I love it.
Yeah, because
I
it's
love
allocated at a specific time, and you also have to balance, as you would remember from your general practice days, if you've got a hygienist, you can't leave a patient with rubber dam in your room while you go and do an examination in the other room. They can't talk, they can't do anything. So
exactly.
you have to time your book perfectly. Jeff, we've run out of time. In the show notes, we're going to put the link as to how the people get in touch with you to find out more about the caps,
Perfect.
so that they get referred the right way,
Yep.
and that there'll be some benefits for them for doing that. Appreciate your time. Thank you, Geoff Hall, for being a guest on the Ultimate Dental Podcast.
Oh, thank you, David. I really enjoyed it. So thank you so much.
Yeah, it's been a pleasure. Thanks, Jeff.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favourite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the ultimate dental